Hi, my name's Carly. I'm a speech pathologist who has many years' experience working both with infant feeding and paediatrics, and in Cleft, both for communication or speech support and feeding. So I just wanted to jump on today and talk through some feeding options for if your baby has a cleft lip and or palate. Can be really overwhelming getting that diagnosis, and especially to know what that looks like in terms of feeding, whether you get the diagnosis before your baby's born during one of your antenatal scans, or whether you get the diagnosis after birth. So my aim today is to talk through some different options to hopefully make that a little bit easier for you, and so that you feel like you've got some information and know where to start and what your options are. So very briefly, I'm just going to have a quick chat about why a cleft impacts on feeding, and then for the different types of cleft, what your feeding options might be. So cleft impacts on feeding because when a baby sucks, whether that's on the breast or the bottle or a bottle, they need to create essentially like a vacuum or a seal within the mouth using the lips at the front and then the palate or the dangly bit at the back of your mouth to create that vacuum. So that helps to draw the milk out of either a nipple or a teat, as well as using their jaw and their palate, the roof of their mouth, to compress on it and draw milk out. So when a baby has a cleft, whether that's just the lip or the palate or both together, it interrupts that vacuum. So the hole caused by the cleft means that it's a lot harder for them, and in some cases they're not able to create that vacuum to be able to get that suction and help draw the milk out of the nipple or the teat. So sometimes we need to look at some slightly different feeding options for our babies with a cleft so that they're able to effectively and efficiently and safely still feed and gain weight, which is what we want. So we'll start with talking about cleft lip only. So if your baby is born with just a cleft lip, no palate involvement, often babies with just a cleft lip can still successfully breastfeed. They may need some bottle supplementation, but often they can still successfully breastfeed, and some fully breastfeed. Generally, you're going to need some support from a lactation consultant or a speech pathologist, ideally with some experience in cleft, to find the right positioning for the baby and some support strategies so that they are able to create that seal. We can often use the breast tissue to kind of fill the cleft to help create that create that vacuum and that suction so that they're still able to get the suction. And sometimes some different strategies also support, like supporting the lip to get that nice tight seal. And also bottle feeding. So some people obviously don't necessarily want to breastfeed or can't breastfeed. So when you're looking at bottle feeding for baby with a cleft lip only, often they're able to feed just on a standard bottle that you can buy from a supermarket or chemist or wherever. Again, they may need some support with some different positioning or some different strategies to achieve that seal, so that they're able to create the vacuum and therefore be able to use suction to help draw milk out of the teat. Again, a speech pathologist or you're the cleft nurse on your cleft team should be able to help you with what works best for your baby, what strategies they need, what positioning, all of that kind of thing. But generally, as I said, either standard breastfeeding or standard bottle feeding is effective for our babies with just a cleft lip. It's a little bit different when we look at our babies with a cleft palate, whether that is a cleft palate only or a cleft lip and palate. When you have that involvement of the back of the mouth or the roof of the mouth, we're not able to use positioning or that kind of thing to create that seal in the mouth. So generally, full breastfeeding or standard bottle feeding are not going to be effective for those babies. So for them to be able to feed well and safely, and for it to be enjoyable for both you and your baby, we're going to need to look at using a specialized Cleft bottle. So they work a little bit differently to a standard bottle. There's lots of different options in terms of Cleft bottles, which I won't go into in this video, but will in later videos. And they all work slightly differently or have slightly different features, but essentially the difference between a Cleft specialized bottle and a standard bottle is that there will be a valve in the Cleft bottle that helps to create that suction and that seal, so it effectively overcomes the baby's anatomy and not being able to create that seal on their own, so that then all they really need is the compression, so using their jaw and the roof of their mouth to be able to press on the teat to extract milk out, and the bottle does the suction component of it. What you can do though, if you are really wanting to breastfeed and that was something that you wanted to do or is really important to you, you can do some comfort feeds with your baby. So they generally won't be able to extract enough milk to be able to feed to achieve their nutritional goals, but you can use some comfort feeding as a soothing mechanism or soothing tool, and also just for that bonding experience with your baby. The other option is to express breast milk and offer it via a Cleft specialized bottle. So your baby still gets the benefit of breast milk. If you're wanting to do that, that option is not right for everybody, and that's absolutely fine. But if it's something that you're wanting to do, that is definitely an option, which again, your Cleft team or Cleft nurse or a lactation consultant can support you through the expression process and what to do, and strategies to maintain your supply and all of that kind of thing. There is an exception to breastfeeding with a cleft palate if your baby has a soft palate cleft only, so the soft dangly bit at the back of the mouth, not the hard roof of the mouth, and it's quite a small cleft. Sometimes they are still able to create enough of a seal and a vacuum to be able to effectively and fully breastfeed, or potentially partial breastfeed with some bottle top-ups, but again, I strongly suggest you get support from your Cleft team, lactation consultant, and potentially your Cleft speech pathologist as well, to help you through that, to help you implement any strategies that might help or that are needed for your baby to be able to successfully breastfeed, and to make sure to monitor that they are feeding well, they're feeding safely, and they're able to maintain their growth if that's the path that you go down. So that's a really quick overview. I hope it's been helpful just to give you some idea of what your options might be. Please follow along, hit subscribe. I'm going to be posting lots more videos around Cleft feeding, different options for feeding in terms of bottles and all of that kind of thing, and also some strategies to help support feeding to make it really successful and enjoyable for you and your baby. Thanks.